I wish I were here to report better circumstances, but unfortunately today we find ourselves yet again crossing a threshold we don't want to cross. Because of the Omicron variant, over the past month, we've seen the number of people testing positive for COVID-19 increase exponentially. In other words, we are in the midst of another COVID-19 tsunami. And this time, it truly is a tsunami when it comes to those cases. It's like nothing we've seen before in this pandemic. We've all seen the results of this tsunami of cases firsthand. Teachers, students, parents with the virus. We've seen airlines canceling flights. We've seen businesses having to close earlier because their workers are sick, co-workers out of commission. We all have those stories of people we know. Mercilessly, up until now, this wave had spared us from the sharp increase in hospitalizations that we had seen in the other waves. And that is until now. Because of an increase in the number of folks being hospitalized for COVID-19, today I am raising the county's COVID-19 threat level to level 1, threat level red. It is the highest level. The 14-day average of COVID-positive ICU cases is now 18.1%. The positivity rate is 35%, and the cases continue to climb. This level signifies a severe and uncontrolled level of COVID-19 in our community. It's the third time we've elevated the COVID-19 threat level to red. The first time we went to red, it's because we were in many ways helpless. We didn't have vaccines. But now we're at red, unfortunately, because of a lack of action among those who are refusing to get vaccinated and are ending up in our hospitals. Hopefully, and truly, this could be the last time we go to red. We can make that happen. So I don't want it to all be bad news. So much has changed. As treatments continue to become more available, and they're becoming more available, as more people get vaccinated and boosted, we can make this the last time this happens. But for right now, for the sake of our hospitals and for the sake of our workforce, we have to sound the alarm once again. Not only are the hospital beds being consumed by COVID patients, but the workforce is having to miss work because so many of these health workers have the virus themselves. Even if they're not so sick as to be hospitalized, they have to be home. In a couple of hospitals, I've heard up to 10% of the staff is out with COVID. And so what does this mean for you? What does this mean for the community? The solution to keeping our hospital beds clear for non-COVID patients, for the car accidents, for the pregnant woman that needs to give birth, for the appendicitis case, the stroke, the heart attack, the solution to that is to get the vaccine and get the booster. Do that now so that you help people who may find themselves in need of a hospital bed. The solution to so many workers around our county, including hospital staff, getting ill and missing work, is to take common sense measures to contain the spread of the virus, even if you're vaccinated. Residents experiencing symptoms, COVID-like symptoms, should get tested and avoid contact with others, assuming they have COVID, until they confirm otherwise. Any gatherings should be held outdoors, ideally with masking, as much as is possible. Unvaccinated residents should avoid all gatherings and get vaccinated immediately. You can visit Ready Harris to find a place for a test or to get vaccinated. I want you guys to know Harris County is doing its part to help alleviate the impact from this latest wave. I know parents with students in school in particular are very stressed. Many have been frustrated by a lack of rapid testing availability. So last week we approved an effort with support from Commissioner Ellis and Commissioner Garcia to deliver 110,000 tests to school districts across Harris County. We are also working with CETRAC, our Regional Advisory Committee, to fill gaps, to provide tests. PCR tests continue to be widely available throughout the county, and they're the gold standard. But I know that it takes up to 48 hours or more to get the results back, so that sometimes that can be difficult. But we do have over 10 Harris County Public Health sites with these PCR tests. So in providing rapid antigen tests to schools, it's another source of information for parents. It helps kids who are contacts of cases be able to return quickly by getting a test quickly, a result quickly, after we know that they're asymptomatic and they've tested negative for the virus. It helps our teachers as well. It simply helps us return to life as usual more and more. Here in Spring ISD, the school district will be receiving 2,250 of the tests we're delivering, and I am so grateful for their participation in this effort. We are also here to announce a new testing site for Harris County. Thanks to the partnership with Spring ISD, starting tomorrow we are opening another testing site at Planet Ford Stadium. It'll be able to accommodate 300 PCR tests each day, and it'll be open for at least the next 2 weeks until a FEMA site opens up also in the same area that will have even more capacity, we hope. Registration for this Planet Ford Stadium will be available starting at 4 p.m. today at readyharris.org. And as I said, it's only one of over 10 Harris County Public Health sites throughout the county offering thousands of tests every day. I can't be in this beautiful library and not take a moment to thank our teachers, to thank our staff, to thank these incredible frontline workers that have had some of the toughest jobs throughout the pandemic. So I want to acknowledge them and remind everybody that anything we can do to alleviate the stress on these incredible frontline workers and alleviate the stress on our parents, on our families that are facing so many challenges as the kids return from winter break, that we should do this. And I want to thank Spring ISD again for their leadership since day one. They have been following the public health guidelines. They were some of the very first ones out there with masking, and that has shown in the results they've had, and really bringing the community together. As with the start of the virus, it's a community issue, and it's an issue that we solve together as community. And I hope that all of us can continue to work together to make it through.